Good evening and welcome to our town hall. It is exciting to be talking with you 1 week before the start of the 2021-22 school year. And as the superintendent of the Dublin City Schools, I can tell you that we are excited and energized to welcome all of our students back to school next week for the first time. As we go through this presentation tonight, and as we announce some changes to our safe return in-person instruction plan, I think it's important that we recognize that this is a fluid process. That since last Wednesday when a plan was announced, many things have changed. And the situation with COVID in our community and in our county isn't getting any better. We get asked a lot of questions about how are decisions made. And as I shared with the Board of Education on Monday night at the board meeting, one of the consistent themes that I heard during my first 100 days was the need for transparency. So this evening, as we go through our Safe Return to School plan, I'm proud to be joined by two of our advisors, two folks who help us in the Dublin City School District and advise me, our board, and our team when it comes to COVID-19, our health plans, and what we do. I am proud to be joined this evening by Dr. Gregory Lamb, who will be sharing with us the position, the thoughts, and the expertise of the Superintendent's Medical Advisory Team. This team is comprised of members from our different COVID and medical teams that served the district so well last year. And last year when we were looking at data metrics and different protocols and communications and mental health and sports and athletics, we had a number of teams of physicians, of medical experts, of PhDs that helped us out. Well, this year, we've got volunteers from all those teams who are serving our district and providing advice right now on the timely topic of masks, vaccinations, and how we bring students back to school. We are also joined by Mrs. Jessica Philemon, who's with Scott Scriven LLP, and Jessica is one of our attorneys who helps us out in a number of different areas. And as I've said to a number of people before, we've got a team of educational experts, but we rely on our health experts to help us with health decisions and our attorneys to help us with legal decisions. So we're excited to have them here. I thank you both for being here. And as we go through this presentation, there'll be lots of opportunities for us to engage. One thing that I'd like to share from the start, when we came into this space, we did have our masks. But as we're 6 feet apart and we want you to be able to hear us clearly and see us as we have these conversations with you, our masks are taken off as we do this presentation. So let's get started. Where are we and where do we think we'll be next Wednesday? So as we go through, just a quick recap. Last Thursday, the Ohio Department of Health released fact sheets and guidance for schools across the state of Ohio. 5 main bullet points that the Ohio Department of Health recommended to us as school districts. Recommending vaccinations for all those who are eligible to be vaccinated. Strongly recommended face masks in the K-12 setting, particularly for those who are not fully vaccinated. Maximizing distance between people to the greatest extent possible. Prompt identification and appropriate care for people who exhibit COVID symptoms and test positive. And practice the layered mitigation strategies, the hygiene and environmental cleaning that served us so well as a community last school year. We have one goal, and that goal is to keep our kids safely in school. One of the things that sometimes gets lost with this goal is we did have COVID learning loss last year. And with our different modes of instruction, not every student thrived in the online environment or the hybrid environment. For the majority of our kids, they need to be in front of our amazing teachers every day in our classrooms. And in order to do that, they've got to be safe. Tonight, I am announcing that I will be activating the mask requirement as permitted and as required by the board for all students in grades pre-K through 8, beginning on August 18th. This is a temporary mask requirement. This mask requirement will be reviewed on a weekly basis. And in a couple minutes, Dr. Lamb and I will be discussing what are those triggers, what do we look for, and what are the data points. Repeat again, a temporary mask requirement for students in grades pre-K through 8 indoors beginning on August 18th. Masks provide this additional layer of protection to students who are unable to be vaccinated at this point or in buildings where there are students who are unable to be vaccinated. This is in alignment with our health agencies. For our students in grades 9 through 12 in our high schools, we strongly recommend that masks are worn in indoor settings. The Ohio Department of Health, as part of their fact sheet and COVID protocol, has indicated that quarantine is not necessary for students and adults if they're not fully vaccinated, but they're wearing a mask. This statement that we shared on Monday has created some questions for us. And Dr. Lamb, we have talked about this at length going back to our first doctors committee meeting. Can you share what has led the Ohio Department of Health to this position and the pros and cons of a one mask versus two masks scenario?
Yeah, thanks so much, Dr. Marchazzi, for having me here. And thanks so much, Dr. Marchazzi, for having me here. And I'm a representative of the Physician Advisory Council to the superintendent, as you said. The mask question is actually very interesting. And it has had some controversy, but in actuality, it's quite simple. Masks work. Masks protect people from the spread of COVID. And most importantly, we now know that mask protects the wearer. So before, we said that wearing the mask protects other people from getting the infection, and that is certainly true. More recent data, however, shows that if you wear a mask, you are also well protected. So for instance, one study that came out looked at an outbreak that occurred on the USS Theodore Roosevelt. And in that study, they found that if you wore a mask, your chances of getting an infection was reduced by 70%. Other studies have also shown that if you wear a mask, the transmission and the case mortality rate decreases 4 times. So it is absolutely true that wearing a mask is important to protect the spread for other people. But we now know that wearing a mask also protects the wearer itself. And I think that's what led to this quarantine recommendation.
2 masks are better than 1? Is that a fair statement?
Absolutely. 2 masks are better than 1. But for the purpose of our school and for quarantine, wearing a mask is sufficient. So if you wear a mask and you're exposed, you will not need to quarantine. And that's the reason why wearing a mask is going to be absolutely essential to keeping our kids safe, keeping our kids healthy, and keeping them in school.
Thank you. So as we know, and as we've talked about, that mask is essential. And for our students who are unable to be vaccinated, we are now requiring masks in grades pre-K through 8. We may be asked why pre-K through 8 and not through 6. And I know that's a question that will come up, so I'll answer it right now. For our students in our 5 middle schools, they're in school together. They're passing together. The vaccination rate among our 12 and 13-year-olds is significantly lower than the vaccination rate of our older students. So right now, and we're saying right now, in our middle schools, during the school day, all students will be required to mask. After the school day, when our students are involved in their athletics and their extracurriculars, and those are limited to our 7th and 8th graders, the masks will not be required with the sports and with some of those other activities. We're going to encourage where possible, but the requirement is during the school day. Again, quarantine came out on Thursday, these changes. Also, students who are currently vaccinated, if they are a close exposure, the Ohio Department of Health is now asking that they wear a mask after being identified as a close exposure until they've either had a negative test after 3 to 5 days or until they've waited 10 days. So we've learned that quarantine is required for students who aren't vaccinated and not wearing a mask. But if you're a vaccinated student, there's still some risk if you come to school without a mask. Students wearing masks will be subject to that modified quarantine, and we are incredibly fortunate. We have 5,000 of the rapid test kits on hand. We're in the process of getting additional rapid test kits from the Ohio Department of Health. And those rapid test kits will be available through our school clinics. If you are a close contact and you want to get out of quarantine sooner with a negative test, we will also make them available to people who may have some symptoms if they want to take that test to determine if they have quarantine and should go on to a different test. I share this flow chart not to go through it step by step, but to make a couple points about quarantine. We've been asked why the difference between vaccinated and unvaccinated students. You're going to make unvaccinated students feel like there's something wrong. Maybe their parent didn't want them to get the vaccine. I'd like to be perfectly clear. The Dublin City School District doesn't determine the quarantine procedures. And I'm going to turn to our legal counsel and ask Jessica. Jessica, can you talk a little bit about how quarantine works, where the legal authority is, and what is it that we're doing as a district?
Sure. The authority under Ohio Revised Code outlines what schools have the authority to do, and then separately what departments of health have the authority to do. So school districts have the authority to issue mask requirements, for example. But under Ohio law, it's only local health departments that are issuing quarantine and isolation orders. So Dublin City Schools will cooperate with contact tracing, but when it comes to the quarantine rules, the school district doesn't have any legal authority to change that. It comes straight from the health department.
And we're incredibly fortunate to have a health department that partners with us, and you serve several districts in the area, and it's this way across the board. Is that correct?
Yes, it's Ohio law, so it applies to every Ohio school district, same way.
So as we work through this, and if there are quarantine questions, we will do our best to work with our health department. We are hopeful that the cases and the situations are small in number so that we can get to things quickly. The other change that came about with quarantine is it can only be by a positive test now or a medical diagnosis. So when you take that test and that test gets read by a healthcare provider or a doctor's office, they're going to send it to the Department of Health. The Department of Health is then in turn going to notify the school. And while if your child has symptoms, if your child was a direct exposure, you may choose to keep them home. That legal quarantine doesn't come until the health department tells us, yes, it's a medically confirmed case, and we are ordering the quarantine or ordering the isolation of a student. So those are processes that may be a little bit slower now as we go through this, and that's due to the changes in Senate Bill 22 as well. So let's talk a little bit now about vaccinations. We are encouraging, as are all of the different levels of health departments and medical advisors, to get the vaccination. And that as soon as you're eligible, get those shots. Dr. Lamb, why vaccination? Why as soon as you can? And how is this going to get us out of where we are?
So, and that's a great question. So vaccinations are our safest way to protect people from COVID-19. One of the questions that I always get is, well, why not just let people get COVID-19? And by that way, then we can reach herd immunity. The only problem with that, though, is that COVID-19 can be devastating. And more recent data with the Delta variant shows that particularly for kids, COVID-19 is particularly harmful. So from a 5-day period at the end of July, there were 74,000 new cases in the United States. Just last week, that increased to 94,000. for kids with the Delta variant. And we now know that Delta variant is the predominant strain in the United States, but also right here in Dublin. So in talking with our pathologists at Dublin Methodist Hospital, when they received sequencing last week, 100% of the cases were the Delta variant. The kicker for that, though, is that was from samples 3 weeks ago. So we now know that at least for the past month, the Delta variant has been the predominant strain here. With vaccines, vaccines protect very strongly against the acquisition of COVID-19. If you do have it, and it's possible to get infected, even if you do have vaccines, it greatly attenuates symptoms. So it dramatically reduces morbidity and mortality. You know, one thing that I actually really do want to point out is that with this new Delta variant, which again is the predominant strain, it's been shown to have a viral load 1,000 times greater. And with that increased viral load, it makes people more susceptible to infections, including kids. One of the silver linings that we had with the other variants of coronavirus was that it didn't really affect kids all that much. We now know that with Delta, that simply isn't true. And we've seen this with experiences in other countries that had predominant Delta infections, in England, in Canada, in Singapore, in India. And we do know that the vaccinations absolutely work.
Thank you. We're not going to be requiring proof of vaccination for students to come to school, but part of this process will be if you are a close contact, you will be asked to provide proof of vaccination, whether you're a student or a staff member, to get that modified quarantine. So part of the Senate Bill 55, again, is we're going to ask you to provide that proof of vaccination. So if you have those vaccination cards, we will accept pictures of them, PDFs of them, both sides, and our nurses will be working with you to get that proof of vaccination.
So one other thing that I want to point out with the vaccinations is that the vaccines are highly effective. One reason why people are hesitant is because they're worried about it. And those worries are valid. And what I want to do tonight was address some of those concerns. There are reports that with some of the vaccines, you can get a higher rate of blood clots. But what I want to do is just put that in perspective. And so the rates of blood clots are very, 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 very low, about 1 in a million. Just to compare that, if a woman, for instance, is on birth control, the rates of blood clots is much higher. Rates of myocarditis has also been cited as a concern, and that is a valid concern. The rates of myocarditis with the vaccines is about 1 in a million to 1 in 500,000, so very low. On the other hand, if you do get COVID-19, the rates of myocarditis has been reported as high as 24 to 44%. And you could get fulminant myocarditis, in which case you're in the ICU and very, very sick on life support. And so in general, when you weigh the risks and benefits of vaccines, the risks are exceedingly low and the benefits are exceedingly high. One other thing that we hear, just if I can have one more minute, is that there's some concern with the rapidity with which the vaccines were developed. And also the fact that it's not yet FDA approved. I actually want to address that because the reason why the vaccines were developed so quickly was because they bypassed a lot of the red tape with vaccine development. A lot of times when vaccines are being developed, a company will do the studies, they'll stop, analyze the data, they'll have to decide whether or not to proceed, they'll have to raise the money, and then they go ahead to the next step. In this case, they took away all the red tape and they took away the risk by the government providing the funding for it. There were no shortcuts in the safety. There was no shortcuts in the study themselves. In fact, these studies have been the most well-studied vaccine in the history of vaccine development, and it's safe. In regards to the emergency use versus the FDA approval, a lot of people don't realize this, but the criteria for the emergency use, to gain emergency use criteria, is actually more stringent than the FDA approval process. And that's to ensure safety. The reason why it's taking so long now is just simply because of red tape, and they're actually hoping to expedite that process, so it is FDA approved. But I understand the confusion. There's a lot of misinformation out there. But from a medical community, it's completely accepted that these vaccines are safe and they're highly effective, and we highly recommend it to protect your family and your kids from developing COVID.
as we encourage our families and our students to get the vaccine, it's listening to experts such as Dr. Lamb and our county health commissioners and our Department of Health and the American Academy of Pediatrics. Just as there's alignment with masks help slow the spread, there's alignment that we should get vaccines. And for us right now, is it fair, Dr. Lamb, to say that masks are the bridge till we can get this vaccine for our 5 to 11-year-olds?
Absolutely. And so, again, with the vaccines, with masks, there are also a lot of questions and a lot of concerns. And I think, again, those concerns are valid, and we need to acknowledge that. One of the things that we hear is that the viral particles themselves are too small for masks to be effective. But I think what people have to remember is that the transmission of the virus particles is actually through droplets. And the droplets actually do get caught by the mask. And it's that way, it's in that way that we actually prevent the spread of the virus. So masks are highly effective. And then as we talked about too, masks are also highly effective in protecting the wearer itself. Until we can get a critical amount of our kids and our community members vaccinated. You know, one thing that I actually did want to mention too was that one of the biggest studies for masks came out of North Carolina in school districts just like ours. They looked at 860,000 students, 160,000 staff, and they looked at all of the things that they did to prevent the spread of the virus. And they found that the most effective thing were masks. Social distancing was important, 3 feet. Hand washing was important. But the most effective thing were masks. And I think that this brings up a good point, is that mask is the most important thing, but a layered approach with the social distancing and the hand washing are all very, very critical to prevent the spread and to keep our kids safe in school.
Thank you. As we look, just a couple things for us to highlight that we've talked about in several of these presentations now. Masks are going to be required on all of our buses. This is a federal mandate. There have been some questions about the authority for that federal mandate. Jessica, can you just touch briefly on that authority? And we're following federal guidelines when we do this, right?
Sure. There's a CDC order that came out. There's the CDC order that came out in January of 2021. That's a federal law, and so a lot of people have asked questions about the definition of public transportation and whether school buses apply to that federal law. The CDC has taken the interpretation that it does, and their definitions of public transportation and conveyances include school buses. So Dublin City Schools and similar to other school districts across the state are requiring face masks on school buses under that CDC order.
Thanks. And just so that everybody's aware, our bus drivers, if your kid forgets their mask when they go to the bus, we'll have a mask for them. Unlike last year when some of these supplies were in such tight demand, we're well stocked with masks, with cleaning supplies, with hand sanitizer, with our test kits. So we're ready to roll for Wednesday with these supplies so that we can keep our kiddos safe. Additionally, the mitigation efforts, as our health professionals say, the multiple layers of protection that we're able to provide in addition to masks and vaccines. And at times we're in schools, we hear, kids will be kids. How are you going to keep them 3 feet apart? Well, that's why we look for multiple layers. That's why we do the best we can. One of those areas and one of the reasons that are in our elementary schools, the requiring masks is so important is because we're going to spread out our classrooms to the greatest extent possible. We're going to get as close to that 3 to 6 feet as we can in our classrooms. But we know some of our kids get a little squirrely. Some of our kids move around a little bit. Some of these kids haven't seen each other in a classroom since March of 2020 because they might have been in RLA last year. So kids are going to be kids, so we have multiple layers of protection. When our kids go to lunch in our elementary schools, we're going to cohort those students. So what does that mean? That means that when a kid goes to lunch, they're going to be sitting at a table next to the same kids every day. There's going to be a level of risk at lunch because you have to take off your masks to eat. And again, our kids are going to be taking off their masks in the cafeteria with other 7-year-olds. So having kids in a cohorted group allows us to contact trace easier, allows us to put kids near other kids that they're around easier. And then we are incredibly grateful. We don't have to have the conversation from last year. When they go outside for recess, they can take off that mask. This is an indoor requirement. And so when we can get outside, if teachers could get an extra recess, if teachers take snack time outside in our elementaries, if teachers spread kids out so that they can get a mask break, we've gotten better at all this, and we're better at these mitigation strategies. In our high schools, where we know from data that approaching 3/4 of our kids are in the vaccination process, in our regular cafeterias, students are going to be able to sit where they want to sit. Our suggestion is be with your people. If you're the flautist in Jerome's band and you have sleepovers with the flute section and you're with them at practice and you're with them all the time and you're all vaccinated, you're probably going to sit at a regular table in Jerome's cafeteria. But we're going to open our gymnasiums for students who want a little bit more space. If you want to have a conversation with someone who's not in your group, maybe you are one of our unvaccinated students for whatever reason, and if you're one of our unvaccinated students, you're one of our family, we're encouraging you to wear a mask, and for whatever reason, we respect that decision. We're encouraging vaccinations, but we respect everyone's individual decision. But if you want to go to the gym to have a little bit more space at lunch, our high school staffs are going to help you with that. All of our district air filters have MERV ratings of 13 or higher on their filters. This is an exceptional statistic for a district this size. And Jeff Stark and our team have done a phenomenal job. And all of our air handlers are set when they are approved for the most airflow permissible by that system. And those are set by the manufacturers when we're being approved by the building inspectors. And we're bringing in as much outside air as possible. We're going to continue to encourage hand washing and have hand sanitizer available. And that's not just for COVID. One of the things that we were hearing in the doctors committee was that RSV and other what would be probably more fall-type illnesses are being commingled with COVID, and that's causing some problems. So we're going to encourage that hand washing. It's just something that we need to do all the time, is encourage that hand washing. And our team will do daily and enhanced cleaning, and that will continue so that we're able to keep those kiddos safe. I'm not going to linger on this form. It's going to be sent out to everyone. Here's the meaning of this slide, and it's pure and simple. If you're sick, stay home. If you don't feel well, stay home. And if you have abnormal symptoms with the fever or a cough or shortness of breath, please get tested. We used to say power through. It used to be a sign of toughness if you could get through that cold and not miss work or not miss school. This year, stay home. Make sure you know it's not COVID. Make sure you're not spreading it to your peers. And we're going to work with you through all of those different issues. So Dr. Lamb, lots of questions coming our way about why the change now? I've got people saying, Dr. Marshausen, you did this last Wednesday, and then 2 nights ago with the board, you're an advocate for parent choice. Why are you changing this now? So what are we seeing in the health community that would lead the recommendations from our advisory committee to reach out and say, John, I think we got a problem?
Yeah, and that's also a really good point too. And I think that what we have to emphasize is this is very fluid. So 8 days ago, the Physicians Advisory Council met, and we debated. We had a very lively debate about the mask requirement. And at that time, while the trends were very concerning, the group felt that the numbers just did not quite meet their criteria to mandate masks. Unfortunately, in the past week, a lot has changed, and it's changed for the worse. And so when we take a look at infectivity and the chances of transmission and the risk to our society, and particularly to our kids, we look at a number of factors. It's not just one factor that we take a look at, but it's a number of factors so we can get a full picture of the risk for our community members. One of the factors that we take a look at is something called the case rate, the new case rate per 100,000. And that's just an indication of incidence. What incidence means is if you were to walk around Dublin, what's the chance that you would get COVID? Or if your kid was in school, what's the chance that he or she could get COVID? And this case rate per 100,000 is one of the measures we look at. Typically, if it's about 25 per 100,000, we get really worried because that means community spread is quite high. At 50 per 100,000, that's what in the past triggered the mask mandate. If it's above 50, people are wearing masks. If it's lower than 50, we can actually ease up on our mask requirement. When we met 8 days ago, the case rate per 100,000 was 48. Now, the most recent data as of today, in our county, it's 69. So it's dramatically increased in just the past week alone. And that's just in our county. If you take a look at the entire state of Ohio, it's actually even higher. It's 72%, and we know that what happens in Ohio filters down and filters across the county. The United States, as a country, it's even worse. It's 178 cases per 100,000. So these are critically high levels, and this is what makes health officials really worried. That's one of the factors. Another factor that we take a look at is case positivity rates, and that's the percentage of cases that turn positive. Typically, we want that less than 3%. The most recent data from our county, from our school district specifically, it's twice that. It's 6%. And when you take a look at our hospitals, the case positivity rates in our hospitals is 10%, so more than 3 times. That's a very concerning statistic to us. One other thing we take a look at is hospitals. So what the capacity rates are for our hospitals. Now, and I'll be honest with you, so usually hospital capacities, we consider that a lagging indicator. That means that once the incidence goes up, we don't really see that trickling down to the hospitals until about 2 or 3 weeks later. So a lot of times we say, gosh, well, what happens in the hospital, it doesn't really indicate what's going on real time. It's usually what we see a few weeks later. The reason why we look at it, though, is because if our hospitals are full, then we can't take care of the sick patients. And right now, our hospitals in Central Ohio are at near capacity levels, so 90% or more. The other thing that's concerning, too, is that we just received word from the Blood Association is that they no longer have the capability to supply convalescent plasma. So one of our key ways to treat people with COVID. And so one of the concerns that we have is that our hospitals are full, we're not going to be able to take care of them, and we may lack some of the critical ways to treat them. And that's the reason why this brings us back to the reason mitigation measures are so important. And paramount amongst that is masks and vaccinations.
When we met as a team on about 8 days ago, the team was in general agreement that a campaign and allowing parents the choice to get to whether they wanted their children masked was general consensus, not 100%, but it was general consensus for our team. The medical advisory team was unanimous that we should encourage masks for all of our students. And now the team is almost unanimous that we need to shift to this mandate. And I so appreciate the help of all of these medical professionals as they reach out and work with us and help us. So as Dr. Lamb had said, we're going to look at this data every single week, and we're going to make a change in our communication with you, our community. You're used to getting your weekly updates from us on Monday mornings. You're going to get your updates from us starting in the next week or so on Monday afternoons. And what that's going to allow us to do is share the most recent data with you. And so you know what we're looking at as a team. Again, we go back to wanting to be as transparent as we can. And as Dr. Lamb said, when we get not at 50 cases, but when we start getting near 50 cases and we see a decline in our positivity rate, a decline in our case count, in openness and more available seats at Dublin Methodist Hospital. When I was home at dinner tonight, grabbing a quick bite to eat, there was a memo that was apparently leaked from Ohio Health that the news stations got their hands on with the percentage capacity at our hospitals. And Dublin Methodist Hospital, right down the street from us, is at 96%. And Doctors Hospital, right down the street on State Route down on 40, is at 98%. So when we look at these numbers, they're of great concern to us. So we're going to continue to monitor. We're going to share with you. We are still waiting for, and you've heard us mention in Dublin and in our surrounding districts, the CATS data, the COVID analytics and tracking system that we have for schools. We're still waiting for that to come live. And one of the things that concerns me is we don't really have that school level data yet. So let's start this school year with masks. And if we're able to provide parents more options as we go forward, that's what we want. Our goal is to allow parents to make those healthcare decisions for their children. The flip side would be to let's start without masks, and when things get bad, then we make a change. I'd rather set the baseline with our students masked and have those conversations with their medical advisory committee.
One thing that we do know, though, is that once the infections rise, it takes several weeks to catch up. We've seen that in Louisiana. We've seen that in Missouri. And so it's imperative that we get ahead of this by trying to reduce infections as much as possible with mitigation measures. And in some regards, we already are on that path of rising case levels. So this is data that I received from Franklin County Public Health just today. And it takes a look at COVID cases by age group. In our district, 4307 and 06. And these numbers are actually really concerning. Actually, I wish I could show this slide up here, but in the age group of 5 to 11, in July, we had a number of cases for the whole month of July. But when you take a look at August, just a third of the way into August, we are more than half of the infections of July. And so that means that we are well on our way to a linear increase. When you take a look at ages 12 through 18, already in August, I remember we're only a third of the way through August, we already have the same number of cases as in July. And so this just indicates to us that these numbers are going to dramatically rise. And so it's going to be even more important to prevent the spread now. And thus the reason why is for the change in the recommendations because of everything that we've seen in the past week that is actually, quite frankly, looks quite dire from a health professional standpoint.
Thank you. And I will keep thanking this team of doctors. People point out frequently that you're an educator, not a physician. Talk to the physicians about the healthcare issues. And one of the reasons that I asked Dr. Lamb to represent the committee here is so that you, the community, hears the same thing that we're hearing as we have these conversations. So let's talk about changes to this plan, because it's changed several times. The plan has changed to now masks are required in pre-K through 8, and that is a change that we will evaluate on a week-to-week basis. That change and that decision was made this afternoon. You'll be getting an email as parents that will go out at the conclusion of this meeting with a link to this meeting for anybody who wants to watch it. So if you know someone who was unable to watch it and wants to hear Dr. Lamb, wants to hear Mrs. Philemon, you'll be able to do that. We will continue to communicate changes. And folks, here's one of the blessings of where we are today. Last year when we made changes jumping from hybrid to remote. And that was a huge change for families because it impacted your lifestyle, your daycare, everything that you did. Hybrid and remote aren't options anymore. And I keep saying that because people keep asking questions. What would it take to go to remote? We're not going to remote. So when we make changes, to make a change from mask to no masks is pretty easy. To make a change from mask required to mask optional, or from mask optional to mask required, we've got masks. We can give them to you. It doesn't change any family schedules. It doesn't change anybody's lifestyles. We can make these changes and we can be nimble. And that's what we want to be able to do. If the health orders change, we can make changes immediately. If there are changes to quarantine procedures, we will notify you immediately. As I think we've demonstrated in the past 7 days, this is going to change a lot. And we're learning a lot. And we've learned a lot over the past 18 months. And we're going to continue to adapt and adjust as conditions and as time requires. So as we look at our mask exemptions, and I know there are going to be a lot of questions about those mask exemptions in what is a really divided community, I'm going to turn to our legal counsel to walk us through what is our school board policy, what is my obligation to follow school board policy and ORC, and what are the options available to parents as we talk with some folks who, quite frankly, are going to be unhappy with where we are now. So we've heard from the doctors. Now, from a legal perspective, where are we and what options are available to our parents?
As Dr. Marshausen mentioned, there is a board policy. It's available for you to read on the district website. It's policy 8540.01. It talks about face masks, and this is a policy that the Board of Education has implemented. And so under this particular board policy, there is language that the superintendent can activate the policy during times of high community spread, such as right now. And so he has chosen to do that for pre-K through 8th grade. Under the policy, there are exceptions that are identified, and Chris Andrus has prepared a mask exemption form that'll be available for you on Google Forms, with the assistance of legal counsel. He's right over there. And on that form, you will see that there are exceptions that are articulated in the board policy, and they are 3 particular things. The first is for a child with a disability that cannot wear a mask or cannot safely wear a mask. The second is for situations where students have been advised for health reasons not to wear a mask. And the third reason is where a student has an established, sincerely held religious belief that would not allow them to wear a face mask. So if one of those exceptions applies for you, you'll fill out the exemption form on Google Forms, and your child's school will be given that information, and the child will have a mask exemption for classroom and for transportation.
And one of the things that we look at with this form is we by all means are not encouraging this form. But we know that some students do have mental health, physical health challenges that they really struggled with last year. And we ask parents to weigh, as Dr. Lamb has talked about, weighing the benefits of that mask and the ability then for them to stay in school. I gave a pretty lengthy presentation last Wednesday to you on a video that came home, and Monday night at the board meeting, and everything in that presentation still holds true. That if you're a masked individual, you are able to stay in school if you're among other close contacts. And we are encouraging the masks to be worn. One of the questions that was submitted ahead of time asked me, why would you give people the policy ahead of time? And it was suggested that by some that we hide the policy and we make it hard to find. One of my commitments to the community is we're going to be upfront and honest about our policies, about our procedures, about our practices, even if it's something that I don't want to happen. We don't hide things and we don't play games. So our legal counsel has advised us on the best way to handle this. The form right now, as we work on our processes, will be live by Friday at noon. And that's our goal. And you may ask, and again, full transparency, why not until Friday at noon? We got to develop the process. Who's going to get that form? Because classroom teachers need it, clinic aides need it, principals need it, transportation needs it. So as we go through this process, for the number of folks who do this, we need to be able to make sure that we've got our processes in place and tested so we don't crash a system or miss or skip a beat. So for those of you who are asking, and I'm sure the word will get spread rather quickly, by Friday at noon, that form will be up and available for people with those three reasons that they would have an exemption. I talked about this before. I know not everybody's going to agree. Unfortunately, the Dublin City School District is kind of a microcosm of where we are right now in terms of our reaction to mask policies. And people have great passion about the use of masks. Folks, we got to come together. One of the things that I mentioned before that excites me so much is I've told our teachers in a series of Zooms this week, guys, let me take the mask heat. You focus on providing the highest quality instruction for our kiddos. So we're going to work with our families. Our trust with our families is still there. We still firmly believe that this is a partnership that we do together. And there are three things now that we need to do. If you can get vaccinated, get vaccinated. If you're not vaccinated, please wear that mask. And for kids in pre-K through 8, you got to wear that mask. And follow the protocols that we have, because those are going to be critical to what we're able to do and to the work that we do in our school district. So we said this is a town hall, and got a little bit of criticism that we're not in a large space, but we had no idea how many people would want to watch, and by doing it this way, we have a quality recording for other folks. We've got some of our key partners here who advise and assist with us. And during this presentation, our communication czar, Mr. Baker, has been getting your questions and kind of grouping them together. At first, we were going to read your name when we read your question, but I think Doug has put them together in a way that we're going to try to get through as many questions as possible. And I will defer to our experts if it makes it so I don't have to talk quite as much. So, Mr. Baker, fire away.
Thank you, Dr. Marshausen. So we've addressed a lot of the questions that have come in through your presentation. There's some topics we'd like to get to here as we go forward, one of which is the mask status for staff, adult visitors as we go through the school year.
With our staff, I had meetings with our staff, and I'm going to tell everybody what I told our staff today. There are times that you're going to be further than 6 feet apart. And while I am not a medical expert or a legal expert, I do have a little background in education. And I know that when a teacher is able to be heard, when a smile is able to be conveyed when a kid gives a wrong answer and reduces fear and anxiety, that if we can be socially distanced 6 feet or more when we're teaching that U.S. history course, we've asked our teachers to use common sense. If you're doing small group work, if you're getting close to students, you're going around leaning over desks, put on your mask. If you're a custodian working second shift and there's not a lot of people in the building, if you want, you can take off your mask. If you're the custodian cutting the tops of the Go-Gurts off and sticking the straws in the juice boxes and helping open the bananas, you're going to have your mask on. So we're going to use common sense and maintain safety, even though we know, and Dr. Lamb would agree, we got a lot of vaccinated people. But when we're in close contact with people, we're going to ask them to wear masks. So we don't want to put our teachers in a position where they're in a teacher's lounge and they're with the people that they've been with all year. They're adults who are vaccinated together. When they're in close contact with your kiddos, we're asking them to make sure that they're masked to keep your kids safe.
Thank you. Excuse me. Will elementary walkthroughs or back-to-school events be affected by tonight's announcement?
My request of our parents is we want to be able to hold these events. As I look at some of the pictures that have been posted on social media, it is pretty evident that the indoor mask advisory isn't moving a lot of people to wearing masks inside. At some of our Meet the Team events in large spaces with high school and middle school kids who we know are pretty vaccinated, it's not what we want, but it's not going to have the risk right now associated at some of our elementaries. I am nervous, and I've really struggled with what to do with our elementary walkthroughs, because in a lot of cases, we have a mom or dad who has a younger sibling. In some cases, grandma and grandpa tag along. And we've got 35 people in a room talking to a teacher that might have 22 young people in it with masks on Wednesday. So there are a couple things that we need to keep in mind, and we've thought about just pulling a plug on them. Because what I can't have happen is a teacher having a confrontation with a parent that they're meeting for the first time over wearing masks. That's not how our teachers need to start this. As I said earlier, I've told our teachers, you worry about the pedagogy and the teaching and the learning, and let the administrators take the heat for the mask decisions. So, mom and dad, parents, please wear masks when we come to our Meet the Teacher nights. Days. Tuesday. When you come into your elementary on Tuesday, please wear a mask. If at all possible, please have one parent come with the child. Please be mindful that none of the children in that elementary school have been vaccinated yet. I know you don't want to put on a mask, but let's be considerate of each other. Let's look out for our neighbor. Let's take care of their kids. And as we do this in our elementary schools, you will be offered a mask when you go into that event. We're not going to force it on you. We're not going to call the police. The teacher's not going to create a confrontation in the classroom. But we are asking that you wear your masks to our Meet the Teacher event and to our open houses. It just keeps all of us safer.
Thank you. We have a question about the decision-making process in terms of, it is the volume of communication or the content of communication that makes the biggest difference when you decide issues with your team?
Can you repeat that?
This question is about the decision-making process and
Yes.
whether it's the volume of communications that comes to you or board members matters as much, or is it the content of what's in those communications?
It's the content, and we've received hundreds of emails on both sides of this issue. And I've got to be honest, there are a couple people who I've created their own email folders for. There's an individual who I've received over 40 emails from in the last 2 weeks, and there's a mail rule that emails go to that folder, and I look at that every couple days. So it's not the volume, it's not the repetitive nature of individuals, it's the content. I read every email, and I am disappointed I can't reply to everyone personally. If there were more hours in a day, I would respond to every email. And I'm not sure that our community understands that we're also getting ready to start a school year. Like, this is normally a crazy time for us as teachers, as administrators, as school leaders. The week before school is normally off the charts busy, and we're living up to our responsibility and handling every event that comes to us, and we're handling this the best we can. But I really wish I could get back to everybody individually. But Mr. Baker, no. And for those people who have asked, I can't read Facebook. As the leader of this district, I just can't do it. And people have asked me if I've seen things. No. Every once in a while we get screenshots of things from here or there, But I think if you talk to most superintendents, we're not on Facebook because it just wouldn't be healthy as we try to lead the district.
I'm sorry to interrupt, but I just feel like I really should say something about this. I've had the opportunity to work with Dr. Marchhausen for a little while now, as well as the administration. And one thing that I can say is that they are very thoughtful about their decisions. There is no premeditative agenda. What they're trying to do is what's best for our kids to keep them safe. They're weighing the evidence. And I know it's tough. You know, I told him that, you know, from my standpoint, it's easy because I'm a physician. And for me, the most important thing is keeping people safe and alive. But his job is a little more complex because he's dealing with much more than just simply the science. And it's a difficult position. And what I can say is that I've been greatly impressed with the thoughtfulness that you and your staff have put into this. You're considering everything, and that's tough to do. I know that he has lost sleep over this. I know that he weighs this, and I know this is because he actually texts and emails at like midnight and then again at 5 o'clock in the morning. And so I know that this is a very tough decision that you're not doing you know, negligently. You're putting a lot of thought into this. And so I would just hope, and this is in the vein of what you're saying about people coming together, is that we keep in mind the most important thing is keeping our kids safe and healthy and keeping them in school. And I do think that the decisions that you made reflect this. And as you said, you know, things may change. This is a fluid thing, and so we can always change this. But the way that we change this is by doing the things that we need to do to reduce the numbers, and that is wearing a mask and encouraging vaccinations when we can.
Thank you so much. And Dr. Lamb generally returns those texts and emails at about the same time. So I appreciate the 5:15 and 6:45 phone calls. So it's a tremendous team. And one of the things that I've learned in my short time in Dublin is our community will do anything. And we'll get through this, and we will come together. And ultimately, our goal is to provide an elite education to every child who comes in and help him or her reach their highest potential. And that's what we're going to do. And we'll get through this, and we're going to come together, and we'll be stronger at the end of this. All right, Mr. Baker, keep them coming.
Several questions about, in the event of quarantine and missed instructional time, what can we do for those students?
Well, in our high schools, we will continue to provide instruction during Schoology. Our teachers have gotten quite adept at providing distance learning to students who need distance learning. In our elementaries, through Google Classrooms, we will provide videos of things when videos need to be provided. We will provide those tests. Right now, if you are a quarantine kid, you should be able to get back with only missing 5 days of school. If you are in isolation because of COVID symptoms, depending on how long those symptoms last, it may take you a little longer. One of the things we're not going to do this year is we're not going to do live streaming from our classrooms. Live streaming provided a myriad of challenges. We had given teachers off on Wednesdays at the secondary level to get things ready for those live streaming and those RLA kids. And as I said earlier, those aren't options anymore. We're going to be in school every day. Your kids are going to be in school every day. So it's going to be tough for the kids who get into those multiple quarantine situations. But here's what we know. If you wear a mask to school, you're not going to find yourself in multiple quarantine situations. If you get vaccinated at the secondary level and wear a mask to school, you're not going to get caught in those multiple quarantine situations. So we have the tools to avoid some of those cyclical things that without masks or without modified quarantine had led some of our colleagues in other districts to a kid getting quarantined, coming back, being a close quarantine, going back, and getting stuck in a quarantine loop. We can avoid that. Get a vaccine or wear a mask. So that's kind of the message here as we go through this process.
Can you talk a little bit about the process for when there is a confirmed case in a classroom or a school? What are the things that we do in terms of notifying parents and the next steps?
When the health department notifies us of a confirmed case, it goes to the clinic assistant and nurse in that building. And we will do very similar to what we did last year. The assistant or nurse, it's a little bit easier at the elementary level. We'll talk to the teacher of the child who's the confirmed case. We'll find out who were their close contacts in the classroom setting, in the related arts settings, in the lunch settings. We will go back and look at why we have assigned seats on the bus and identify every close contact that there's been with that student. Then we'll look at those close contacts. Did we maintain our layered mitigation protocols? Were we able to maintain 3 feet, masks on for 15 minutes or less, in terms of exposure with 15 minutes or less being that number? And we'll look at all of those different layered mitigations, and then we'll report back to the health department. And the health department tells our nurses who needs to be quarantined, who needs to be isolated, and what needs to happen. So we're pretty good at that, and we've learned a lot from last year. Now, there are going to be a couple other layers here that are going to be a challenge, and I'm not going to sugarcoat it. At the secondary level, you're a vaccinated student who was a close contact. Now we're going to tell you you need to put on a mask for 3 to 5 days until you get a negative test. There are a couple other layers here that we're going to have to work through, and we're going to need to work through with our teachers, with our staff, with our coaches, because as we look at our coaches, we're looking at the excitement and joy, and I can't tell you how much I'm looking forward to those first Friday night football games where we're going to be outside, and our marching bands are learning their routines and their programs unlike what we got to do last year. But we're going to have to do the contact tracing if there's a positive. And I know we've been through this with some of our sports teams already, and we're very thankful at the number of students who are producing those vaccination cards, and we're able to keep our kids on the fields, in the band, and in competition, and that's going to translate a week from today to in the classroom.
A few questions about how the district, how individual schools will handle mask wearing in terms of any bullying or teasing that might take place along with vaccination status.
Well, like anything that we have, we want to value every student in every classroom, and we have the highest respect for your decisions as parents. And as with any bullying, it's not tolerated. And we get to set the tone. And it's as simple at the beginning as having conversations with students about what our expectations are. And if those expectations aren't met, then there is clarity in the consequences and consistent application of what those rules are. We are really fortunate right now that we have the opportunity to set the table. And on day one, we set the expectations. And our principals and our teachers will set those expectations as clearly as possible. And we will be as consistent as possible with the application that your decision to wear or not wear a mask, especially at the secondary level where we're encouraging it, we're encouraging secondary high school students to do it, but we will not permit bullying of students who either do or don't, and we will not permit those same types of conversations for students who may choose not to get vaccinated or choose to get vaccinated.
Thank you. We've had a few questions about lunch. I know the answers depend on the level that we're talking about, but in general, can you address how our lunch processes will work?
Well, and as I said, I think our biggest risk is lunch, because it's the time when students clearly cannot have their masks on. So at the elementary level, students will be in groups. They'll either be assigned seats or assigned tables so there can be consistency in who they are eating lunch with. The biggest risk to exposure in our school settings is lunch, but we got to feed our kids. So, and when you look at a place like Jerome High School, where there are over 1,930 kids, I think last I heard, cafeteria is not very big. So students at the high school level will choose where they go eat. And when they choose where they go eat, we're hoping you talk with them. We will talk with them. Teachers will have the conversations. Coaches and band directors and directors will have the conversations. Know who you're around. Be consistent with who you sit with. And we're going to do our very best to get as much space as possible. The problem would become if we try to spread them out where they have 6 feet in some of these cafeterias, the elementary kids would walk in the door and eat lunch, and now you're looking at a snack later in the day. So there is a time that we have to do those lunches, and there's a reality. And what I tell folks is we're going to do the very best we can.
Okay, 2 more questions. How do we plan to enforce our mask requirement?
If a student comes to school without a mask and they haven't provided an approved mask exemption, the student will be taken to administrator, and the administrator will call mom and dad. And there are 3 options mom and dad have. Option number 1, please have your son or daughter wear a mask. Option number 2, please come and get your son and daughter if they're not willing to wear a mask. And option number 3, we do have a mask exemption process. We can run you through it and send you the form if necessary. So there are 3 options. That's where we want to be. Let's go back to our very first point. We have one goal: kids safely in school. We know how we can do this. And we're, as I said, I'm just excited to get this kids back on Wednesday, because I think once we get going and once we get rolling, we're going to prove that this is something we're pretty good at.
Thank you. I think this is a great question to end on. Do you think there are or are not any silver linings in this pandemic?
I think any time that there's tragedy, it's hard to find a silver lining. I think all of us have lost someone or know someone who's lost someone as the result of what we can only hope is the deadliest pandemic in any of our lifetimes. We can only hope that it's another century before we have to deal with something like this. Have we been forced to learn new things? Yes. As a district, as a profession, and I think that our medical experts would tell us the same thing, we've learned some things. My guess would be, and I know we're running out of time, but my guess would be Dr. Lamb would talk about mRNA vaccines, and it's a medical advancement that was accelerated as a result of this. Is that fair?
Kind of. mRNA vaccines have been around for over 19 years. It's been used in other vaccines, so actually we do know a lot about it, but this is the first time that the public has found out a lot about it.
See, that's why I don't make medical decisions. As educators, you know, we got asked about quarantine. We're going to be we're going to be much better prepared to get information and to continue education when kids are at home. We still have our Dublin City Schools Virtual Learning Academy. And although registration is closed for the students who are in our virtual academy, we are going to be able to provide a Dublin quality education to students who need to be home. And we've learned to use technology better. So there are some things that we're going to do better as the result of the pandemic, but I think everyone would agree we would have been better off never knowing what COVID is. And if we hadn't had and lost the last 18 months, that would have been a blessing. But we are optimists, we have faith, we have hope, and we know that we are going to continue to provide an elite education and do a amazing job with our classrooms, with our teachers, where the magic happens with what we do every day. Mr. Baker, anything else on your end?
I think we've hit a lot of topics tonight, Dr. Marchesson.
Mrs. Philbon, any last comments as our legal counsel?
No, I appreciate this, and I appreciate the opportunity to be here with you tonight and all the time and effort you've put into what's typically a very busy time of the year.
And we thank you and our partners at Scott Scriven for all your help. We've all gotten a lot closer during this time as we've worked through some of these challenges. And Dr. Lamb, thank you. Any parting words for our town hall people?
Yeah, I know masks are tough. I've talked with lots of kids and parents, and some kids have problems with it. I've talked with teachers, and teachers lament the fact that they can't see the faces of their children, and sometimes it's hard to teach. And those are all very valid concerns. Masks are not perfect, but masks are the best things that we have to protect our kids, to get us out of this pandemic, and to get kids to be able to come back to school safely. From a personal standpoint, I take care of COVID patients in the ICU on the medical floors and also in my office when they come in after the COVID infections. In fact, I just had a young gentleman who had COVID in January and is still having shortness of breath and palpitations and chest pain. And so what I see is the devastating effects of COVID. Fortunately, it doesn't happen to everyone. And our hope is that we can prevent it from happening to our kids and our families. And we think that the masks are the best way to do this. So we just encourage and plead with people to comply, to wear masks, to keep your kids and your friends and your families and your neighbors safe. Thank you.
And to our community, thank you. The vast, vast majority of our communications, even when we don't agree, have been pleasant and civil. As I told the board, I think we need to recalibrate how we are able to disagree in a respectful manner. But as your superintendent, one of my messages is we want to hear from everyone. Our diversity is our strength. Our community is dedicated and proud and passionate about our school district. We're going to continue these conversations. We're going to continue opportunities for engagement. And as we go through this year together, we're going to find ways to come together and to do those things that we know are critical for the students in the Dublin City Schools. Thank you all very much. Stay safe and have a great evening.